Hi, my name's Maria Paley and I am doing the debriefing for Nursing 4215 Global Health Practicum. So the first question we have is, tell me where you saw caring exhibited in the scenario. I feel like the nurse was trying to care for the patient. She was starting to ask the questions, but then would not listen to what the patient was telling her. It was like she was just going through the motions of discharge without actually listening to the patient. So I quite honestly don't think she was caring when she was in the room. She seemed to be exhibiting some caring when she was outside the room talking to the other nurse, but as far as when she was interacting with the patient, I didn't see much caring at all. The second question was, tell me what behaviours you observed that were not caring behaviours. So when the patient was asking for pain medication, instead of talking about the pain scale and how it works and how the doctors prescribe certain medications for deliveries, is it a vaginal delivery, is it a C-section? That would have been a caring behaviour as a nurse, because that's what the patient seemed to care about at that moment in time. So she could have sat down and explained that a bit better and talked to her about different ways to treat her pain that weren't just medicine. So I also think that she could have done a better job talking to the patient. Not that it's our job to talk about social aspect, like the fact that she doesn't have a home, that she could have asked her a few more questions, and then she would have had more knowledge to go get a better resource for the patient when it came to her going home and where she was going to go with her baby. So she didn't seem to care that much about where she was going when she left the hospital, and that was a big deal because so many young mothers leave the hospital and they don't have places to go, and it's a problem that needs to be addressed, definitely. How would you respond in this situation? I would definitely call social work. I would definitely get social work involved. I would talk to the doctors more. Would she be able to stay in the hospital another day? I would get the doctors to talk to her about her pain, and also, try and get her some more supplies to go home with, and support groups that are out there for young mothers. Get her situated with follow-up appointments pretty immediately after she left the hospital, and just set her up with people that would be able to help her in the upcoming weeks after discharge. Tell me about the priorities in this scenario from the patient's viewpoint and from the nurse's viewpoint. Well, from the patient's viewpoint, she was just more concerned about her pain and her medication. We don't know if she'd had any sort of drug abuse. We didn't have enough background history to know that, but that was her priority at that time. And she did say a couple of times, I don't have a home to go to. So she brought that up, so I feel like that was a priority when the nurse was talking to her, and that was a concern of hers. The nurse was just trying to get the discharge completed and get the patient out of there. She was going through the emotions of discharge and not and not following up on the patient's concerns. She did show her how to change a diaper, which was good, but there's so much more that needs to be done for a new mom and a young mom who has no idea what she's doing. Tell me about the resources that could be offered for this patient is question number 5. Well, she definitely, again, could go to social work. Social work could help her out a lot. Does she need a car seat? You know, what's the baby going to sleep in when it goes home? You know, talk about safe sleeping. There's so much that needs to be done on a social work level, and then just the resources when she gets out of the hospital, places that she can go where she can have help. So the patient needed more time, definitely, in the hospital to set her up for success when she left. Because if she left after this nurse had discharged her, I don't know what would have happened to her and her baby, and it's kind of sad, and I'm sure it happens a lot. How would you transfer what you learned here to the practice setting? I would definitely just spend more time with the patient. Education after mom has had her child is key, and if you've said it, say it again. You know, make sure they hear you. Make sure they can teach back what you're teaching them. Make sure they can demonstrate. If you show them how to change a diaper, have them show you how to change a diaper. Ask them how many times should the baby be fed. You know, ask them about bathing. Ask them about safe sleeping. How do you put your baby safely in a car seat? So I think education is a huge factor for this scenario, and then getting the resources definitely to help the patient moving forward for her baby and for herself, because she, like I said, we don't know her background, but she definitely was talking about Percocet and pain, so maybe she has a history there, and that needs to be addressed too, because you don't want a new mum on Percocet with a brand new baby, and you know, trying to get Percocet off the street would be a lot worse. So explaining to the mum about that, and just really spending time, and it will take you more time. Yes, it will. And if you're busy, which you know every nurse is, it's going to take you more time, but in the same instance, you have to help a patient like that, because it's just going to be a vicious cycle if you carry on letting these young moms go home. So definitely resources is a huge one, in education, and telling the rest of the medical team so you're all on the same page, and communicating with each discipline so that she can get the best care possible before she leaves. Thank you.